Good afternoon, everybody, and welcome to our webinar on the 2019 novel coronavirus, also called COVID-19. I'm Dr. Caitlin Padati. I'm the State Epidemiologist and Public Health Medical Director here at the Iowa Department of Public Health. I wanted to start with just a little bit of housekeeping information here. So we're going to have everybody muted during the presentation, but we do want to hear your questions. Please do feel free to enter those at any point into the Q&A box located in the control panel at the top of your screen or bottom of your screen. And we'll go through all those questions at the end of the presentation. And this session is being recorded and it will be made available to you after the presentation. You'll get that through a link that will come by email. So again, I want to thank you all for joining us this afternoon to talk about COVID-19. What we're going to do is give you a little bit of the background on this virus and the current epidemiology or patterns that have been changing over time. We're going to talk to you about the traveler monitoring and healthcare screening activities that public health is performing. We're going to share with you some recommendations for Iowa child care centers. We'll talk a little bit about some of our communication resources, and then we'll go ahead and open it up for Q&A. So when we talk about coronaviruses, this is really referring to a large family of viruses, and they get their names because some of the structures on the outside kind of resemble a crown. So we know that there are some of these viruses that can infect people, some that can infect animals, and a couple that can do both. And there are actually 7 different types of coronaviruses that can infect humans. And 4 of those 7 are very common. They cause sort of mild symptoms that look sort of like the common cold. And most of us have probably had one of these at some point in our life, and we just didn't know which specific virus it was. These are the examples of viruses that right now, sort of up until this point, you might have been tested for in a doctor's office. So in addition to those 4 common viruses, there are 3 more rare kinds of coronaviruses that are able to cause more severe illness. And those are going to be MERS, SARS, and this new or novel coronavirus that we're calling COVID-19. So this COVID-19 virus was first identified in Wuhan in the Hubei province of China. And a lot of these initial cases were actually associated with a pretty big seafood and live animal market in Wuhan. And so it looked like this was maybe something that moved from animals to people. Now, of course, unfortunately, since then, we've seen person-to-person spread of this virus in several communities, as well as well over 35 different jurisdictions at this point. So we think that this virus moves from one person to the other when we're in close contact with each other. So that's within about 6 feet. And it's moving through respiratory droplets. So that means that a sick person is coughing or sneezing, and little droplets of liquid would then land on the mouth, nose, or eyes of somebody who's nearby. We think that people are most contagious when they have the most symptoms, and it's possible that this virus could be passed by touching a surface or object that would have liquid with the virus on it, and then you'd touch your mouth, nose, or eyes. But we don't actually think that this is the main way this virus spreads, and it probably doesn't last for very long on surfaces. I wanted to call your attention to a couple of publicly available tools that you may have seen or might find sort of helpful when we think about the patterns and where cases of these diseases of this virus have been reported. So what you're seeing now is a dashboard that's publicly available through the World Health Organization, and it's reporting cases through the various public health agencies in each jurisdiction, ministries of health, centers for disease control, that sort of thing. And you can see, this is even a little bit out of date already, but we're already at over 90,000 cases and 3,000 deaths reported from different countries around the world. And it appears actually that the case counts in China do seem to actually be stabilizing while we are starting to see an increase in other jurisdictions reporting cases. So we want to take a moment to just acknowledge that there's been a lot of information that's coming out about this virus very quickly, and it can be sort of hard to keep up with various news sources and where to look and how to get reliable information. And as we go through this presentation today, and as we move forward in general, we want to make sure that you know that you can reach out to local and state public health for reliable and up-to-date information on COVID-19, as well as a variety of other public health topics. And we want you to know that we'll be updating our website regularly as new information comes out. And that's going to be a good place to look to stay up to date for what's going on and what you need to know here in Iowa. So I'm showing you now the information that's being shared by our own Centers for Disease Control and Prevention. And you'll see a couple of tables on one side. So at the top, you're seeing the cases here in the United States that are associated with travel or have been detected in the community. Again, this is already a bit out of date. We're at just over 40 cases. And unfortunately, we've now seen 6 associated deaths of COVID-19 here in the US. You're also seeing the CDC share the individuals that have been tested and evaluated for this virus. And then at the bottom, you're seeing individuals who became sick with the virus who were associated with high-risk situations. So these are people who were repatriated to the US from Wuhan and from the Diamond Princess cruise ship. And these groups are being treated just a little bit differently because they came from settings that we knew were high risk, and so they're being reported a little bit differently. You'll also see a map here that's showing you the states that have reported cases so far, and the CDC has been updating this information every Monday, Wednesday, Friday. Similarly, if you visit the Iowa Department of Public Health webpage, you're going to find a couple of tables that we're providing updates on as well. So at the top, you'll find a table of individuals being monitored by public health. So people who are being monitored with no symptoms, whether there would be people who were being who had symptoms and were being tested, and then people who had completed their public health monitoring. And then on the bottom table, you'll see individuals who are being tested for COVID-19 here in Iowa. And we've been updating this information every Monday, Wednesday, Friday on our webpage. We're going to continue to do that, but we're also going to remain flexible and we can share information, more rapidly if we need to. So I want to take a moment here to focus on the CDC travel health notices, and this is going to be an important place to look for information as the spread of this virus to different places continues. This will continue to evolve, and we know that this is hard, but it will be good to have an understanding of how this information is being updated and where you'll be able to find it. And that will be, through the CDC, and, we'll link you to that on our webpage as well. But we're looking at locations that have travel warnings associated with them. So if you start at the top, you'll see that both China and Iran have a level 3 travel health notice. So that means that the CDC is recommending that you avoid all non-essential travel, and there may be restrictions on entry to the United States. CDC also recommends that you avoid non-essential travel to South Korea and Italy, so those are also at a level 3 travel warning, but they don't have restrictions on entry to the US at this time. Again, I would say that it's just going to be important to keep in mind that things may continue to change. And then there's going to be a level 2 travel warning in place for Japan, so that means that older adults or those with chronic medical conditions should consider postponing travel. And finally, there's a level 1 travel notice for Hong Kong. And again, I would just say, we know that information is coming out very quickly on this. We know that things are changing. That's appropriate. That's a good thing. It means that we're adjusting our response as we need to, as new information arises. That's going to continue to happen. And so again, we want to make sure that you know how to reach out to us and how to visit our webpage for up-to-date information. So I'd like to turn now over to Dr. Garvey, our Deputy State Epidemiologist and Public Health Veterinarian, to talk to you about some of the monitoring and screening activities that Public Health has been working on.
Great, thanks, Dr. Padati. So I want to take a few minutes and just give you a quick overview of what measures the public health system and healthcare providers are taking to both monitor returning travelers and also screen patients as they present for healthcare. So in accordance with the President's Task Force on Coronavirus, public health authorities are screening travelers who are returning to the US from mainland China. And we're continuing to monitor these travelers from China because they are still seeing a high rate of illness in China. It's not as high as it was previous weeks, but it's still high. There's no plan at this point to expand those traveler screenings to include other affected areas. And by affected areas, throughout the rest of the presentation, when I say the words affected areas, I'm meaning the countries where there's either level 3 or level 2 travel warnings in place. So we're not planning to expand traveler screening to include those affected areas beyond China at this time because the rates of illnesses in those areas are still significantly lower than the rates that are being reported in China. But in a few slides down the road, I guess, we'll be talking about what we're asking those individuals to do voluntarily. So I want to walk you through what's happening with persons returning from China. So all of the flights from China are being funneled into 11 airports, those airports listed on this slide. And if any of the returning travelers have symptoms, if they're sick, they're assessed by healthcare providers when they land at that airport in that location. And they're not allowed to continue to their destination until COVID-19 has been ruled out. Now, if they're asymptomatic, if they're well, then they're allowed to continue to their destination. And state health departments are being notified by the CDC through a secure communication network that we use for a lot of different things. We're notified who those travelers are, their contact information, their address, and public health authorities are following up with those individuals to assess their risk category and also start the monitoring process. So when I say assess their risk, there's a lot of different criteria that go into determining whether someone is at high risk, medium risk, low risk, or basically no risk. And if you're interested, that information is on the CDC website. But in short, if we identify a person who we feel is at high risk for COVID infection, then we would issue them a high risk voluntary home confinement order that requires them to stay home for 14 days after they left mainland China. In addition, they're required to contact public health twice daily to make sure that they're still symptom-free. If we identify someone who's at medium risk, it's pretty much the same restrictions as high risk, except they are allowed to participate in non-congregate activities outdoors. So what that means is they can go for a walk as long as they stay away from other people. They can go for a jog or they can ride a bike. But other than that, they need to stay home again for 14 days after they left mainland China. And people who are at low risk are issued a public health order called an order to submit to self-monitoring, which requires them to follow up with public health twice daily, just like the other medium and high risk orders, to make sure they're still symptom-free. But these individuals can go about their daily business for the most part. If they're going to travel long distance or leave the state, then they need to coordinate that with public health before they travel. So this is a process that we're taking with travelers returning from China. And these are mandatory public health orders that are being put into place. Now, if there's people returning from the other affected areas, then we're asking them to voluntarily stay home for 14 days after they leave that country and monitor themselves for symptoms. If they do get a fever, we ask them to call their healthcare provider, let their healthcare provider know about their travel exposures prior to going into the medical office. Their healthcare provider can assess whether they need to be seen in the office, and if so, can give them special instructions on what they need to do to make sure they're seen in a way that's safe and doesn't expose others. And I want to just back up a few slides and make sure everybody's understanding, I'm going the wrong way, understanding what I mean by affected area. So Dr. Padati showed this slide, the international travel notices. So anytime we're saying affected area, we're talking about any of the countries that have a level 3 or a level 2 travel health notice. So we'd encourage you to take a look at the CDC website. I'll walk you through how to get to it later in the presentation. And we know that things are changing rapidly. So this list is likely to be modified as we move through this response. But as it stands right now, the countries that would be included are China, Iran, South Korea, Italy, and Japan. All right, I'm going to scroll through slides quickly, so you might want to close your eyes if you get motion sick. All right. So I'm going to switch gears and talk about screening and testing guidance that's ongoing at healthcare providers across the state right now. So we're recommending that all Iowa healthcare facilities implement screening procedures before, ideally, so when people call in to make appointments, or at patient check-in, so at the registration desk. The 3 questions we're recommending that they ask are, do you have a fever or respiratory symptoms? Did you travel from an affected geographic area within 14 days of you becoming sick? And again, those current areas are listed down below, but that's likely to change. And the 3rd question is, did you have close contact with a laboratory confirmed person infected with COVID-19 in the 14 days before you get sick? So if the patient answers yes to 2 of those questions, at least 2 of those questions, then we're recommending that the healthcare provider put on personal protective equipment, so a fit-tested mask, eye protection, gowns, and gloves, and further assesses the patient in the room. So when they do that assessment, they'll check their vital signs, they'll get more information on symptoms and level of illness, they'll find more information out about their travel and exposures that they had, and then we ask that they call us. And at that point, we'll consult with them and we'll make a recommendation for whether testing can be completed or not. Right now, testing is only being completed in Iowa at our state public health laboratory. So the turnaround time at the lab is about 24 hours. It's a relatively quick test. It's about 4 hours. So most of that time is because of transport, having to get it across the state. So currently, the testing guidance, the criteria that has to be met in order to test a patient, is listed on the slide. This is a national guidance. So if someone has a fever or respiratory symptoms and they had direct contact with a lab-confirmed COVID-19 patient, we would test them. If someone had a fever and symptoms of respiratory illness and they were sick enough to be hospitalized and traveled to one of the affected areas in the 14 days prior to becoming ill, we would test them. Or if somebody had a fever or severe respiratory illness like pneumonia or acute respiratory distress syndrome that required hospitalization and we didn't have an alternative diagnosis like a flu diagnosis, for example, we would test them in absence of the travel or direct exposure history. So these are the criteria that have to be met for individuals to be tested for COVID-19 in Iowa right now. So I'm going to shift gears a little bit. And before we really talk about the guidance specific to childcare facilities, I want to talk through social distancing. And social distancing is one of the tools that public health uses to cut down on transmission of disease. I think sometimes when we say social distancing, people think we're asking everyone to stay in their homes and not leave. And that's not the case. Social distancing might include measures like canceling schools or recommending that college classes or potentially childcare facilities be closed, recommending cancellation of events or large meetings, recommending that people limit or do not travel if it's non-essential, encouraging people to work from home if that's an option with their profession, avoid gathering together in any places, even things like lunchrooms, for example. The biggest thing that we want people to do is maintain a 6-foot distance away from other people. So Dr. Padati talked briefly about how this virus is transmitted. It's primarily transmitted through droplet transmission, and so we recommend that if you stay at 6 feet away from another person, then that's sufficient to cut down on your risk of being infected if you're in contact with someone who's sick. Now, for businesses that provide services, like restaurants, for example, we're recommending that they kind of think outside the box. They can do things like expand their carry-out service, or if they are going to seat people in their facility, make sure that their tables are at least 6 feet apart so people have that recommended space between themselves and other people. For customer service professions, we're recommending frequent use of hand sanitizers. We don't recommend that anyone in the general public wears a mask. We just recommending that they do what they can to maintain that distance from others around them. So that's what we're talking about with social distancing. So hopefully that gives you a better understanding of kind of what that recommendation entails, and we'll talk in more detail about what's being recommended for childcare facilities. We've had a lot of questions about when will this start? When would public health make a recommendation like this? And it's really going to be made on a case-by-case basis, and it will be made for specific communities. What's going on in one community will not be the same situation in Iowa as what's going on in another community. So social distancing might be recommended for one part of the state, but not another part of the state. And so it's all going to depend upon the level of COVID-19 activity that's ongoing in a community. And as we know more about the virus, that might change things as well. So again, there's not a black and white answer for when public health is going to make this recommendation, but when the recommendation is made, it's going to be shared with local responders, so your local public health, with your local emergency management. It will be shared with the media. And so this will be a message that's pushed out kind of far and wide, so that everyone in the impacted community knows the recommendations that are being made. So I'm going to shift gears and talk about planning guidance for childcare facilities especially. And I know that we have people that work at childcare centers, large centers, and we have people that have childcare homes. And so I know there's a variety of types of facilities and sizes of facilities and capabilities. And so we're trying to keep this guidance pretty broad and apply it to all types of facilities, because the bottom line is we want all Iowans to take measures to be prepared for COVID-19 coming to our communities, and that certainly includes our child care provider community. So we'd like you to kind of review and update your emergency procedures. And if you have questions about emergency procedures in your community, you can reach out to child care nurse consultant if they're child care related, or if they're related to how you fit into the community procedures and plans and communication, we'd recommend that you reach out to your local public health department. We definitely want to make sure that you have the communication lines in place so that you know who to talk to there locally, and that you feel comfortable with the plans that you have in place. So we're really emphasizing the kind of common sense preventative actions that we recommend for influenza and other infectious diseases. Things like making sure if your children are sick that they're staying home, promoting that everyone's covering their coughs and sneezes, washing hands frequently. And we know that soap and water is by far the preferred method for child care centers, and it's a preferred method for public health. So as many opportunities as you can offer to your children to wash their hands with soap and water for at least 20 seconds, the better. If for some reason it's not possible, we know that you don't have hand sanitizers in your facilities, but if for some reason that's not possible, hand sanitizers are better than nothing, but obviously not ideal. Soap and water is always the best bet. We want you to keep an eye on your absenteeism rates, and this is especially important for the larger centers. So know what your usual absenteeism patterns are at your center or your home among both children and your staff, and review your attendance and sick leave policies to make them flexible. We'd encourage you to do everything you can to make sure your families know when they should be keeping their kids home and know the policies related to that. And it's equally important that your staff understand that they should not be at work when they're sick. So again, use as much flexibility as possible to allow that staff members to stay home if they're sick. And they should be staying home to care for sick family members as well. So one thing that's very clear with this virus is there's a whole range of illnesses. Some people are mildly ill and some people are severely ill. The more mildly ill people can care for themselves in the home or be cared for in the home. And we think that's going to be an important part of this response because we don't want to overwhelm our healthcare facilities. We want our healthcare facilities to be able to focus on the severely ill individuals within our community. So being able to support our families and our friends that are having mild illness that can be cared for at home is going to be important to helping our whole system be able to be flexible and absorb the impact of this virus. So it's important that you also make accommodations as much as you can to allow your staff to stay home and care for those sick family members. We'd also encourage you to identify critical job functions and positions and plan for alternate coverage by cross-training your staff. So if you have key staff that are out ill or their children are ill and they're providing care, making sure that you've got the backup you need to continue to complete those critical functions. And at some point, it might get to the level where you don't have the staff to be able to support your child care center. And it's important that you do some pre-planning up front to know what that level is, so that you're kind of prepared and can do some just-in-time communication and planning when you're starting to approach that level in which you're unable to stay open. You likely already have procedures in place for children and staff who get sick at the child care center or the child care home. If you don't, those should be established, or you should be reviewing those. So when kids get sick or while they're at child care, or if they come to child care sick, they need to be sent home as soon as possible. And you need to keep those sick children and staff separate from the well students and staff until they can leave. So again, you likely have those procedures in place already, but it's even more important to make sure that we're following those procedures right now. One thing we want to be clear on is that child care providers are not expected to screen children or staff to identify potential COVID-19 infected cases. And the majority of the respiratory illnesses that are circulating in our community right now are not COVID-19. It's influenza that's causing a lot of the illness in Iowa right now. So if there is COVID-19 circulating in the community, or if there's a concern about possible exposure at your child care center or home, local officials, local public health officials are going to help identify those individuals, and they're going to work with you on what needs to be done to address risk. We'd also appreciate anything you can do to help educate your child care families about what they can be doing to stay healthy. Again, it's those common sense steps that we talk about with most illnesses: staying home when they're sick, making sure families understand when their kids need to be staying home and out of daycare, hand washing, again with soap and water, and covering coughs and sneezes. We'd recommend that you just perform your routine environmental cleaning. There's nothing different that you need to do for COVID-19. Paying special attention to those high-touch surfaces like doorknobs, light switches, countertops, and use the cleaning products that you normally use in accordance with the directions on the label. So one thing that we're holding out for other types of facilities is that using disposable wipes over commonly used surfaces might be an option. I know that disposable wipes are not something that's used commonly in childcare facilities. So just making sure you're doing your routine cleaning, but potentially bolstering it so you're doing that routine cleaning with a little higher frequency is a good idea. And make sure you have a communications plan for use with your child care families. So you should include the strategies for information sharing that you are already using on a regular basis, and make sure that you're talking to your families now about things that you're doing as a child care center or child care home to prepare for COVID-19. And again, it's great if you can share messages for what they can be doing at home to prepare and to keep themselves healthy as well. So if you're interested, or if you're looking for resources of what you might include with those messages of how families can prepare, we've got a lot of resources on our website that would be helpful, I think, just some general fact sheets, and so does CDC, and I'll walk you through how to get to those resources here later in the presentation. So we're going to transition to our guidance for childcare centers and homes with either identified cases of COVID-19 in their facilities, or when there's COVID-19 circulating in their community. And I want to talk you through at a high level things that will likely be occurring and things to consider. So we would really like to emphasize that child care centers and homes should seek guidance from local health departments to determine when and if and how long their facilities would need to be closed if there was COVID-19 circulating in the community. We don't want you to have to make those decisions on your own. Those are decisions that public health is ready and able to help you with when we get to a point where there would be COVID-19 circulating in communities. And we haven't had a case of COVID-19 in Iowa. It's not circulating in any of our communities at this point. We aren't recommending that any child care facilities close. We just, again, are encouraging everybody to get prepared. But when we start to have that type of community spread, you'll be hearing from public health officials. That's when we'll make the recommendation for social distancing, and we'll be notifying you that we want to talk to you about certain aspects of your business and have some discussions. So the public health recommendation for scope and duration of the closure is really going to be made on a case-by-case basis, as we've talked about in previous slides. It's really going to be impacted by the level of activity in the community. Again, if we are making that recommendation for social distancing, that we would want large events to be canceled, school would be dismissed, child care centers and child care homes, we would potentially make recommendations for closing for 14 days or possibly longer if the situation would warrant it. And again, we want you to work with public health to make those closing decisions, and also to ensure consistency in the message about the nature of the possible exposures. And we always want to maintain confidentiality. If you were to have a child in your center or your home that was diagnosed with COVID-19, we want to work with you on that messaging to make sure that we're maintaining confidentiality for that child's family. And also, if you hear from a child's family or a staff member and they say that they've been diagnosed with COVID-19, please reach out to us. If we get an indication that there's somebody who had exposures at your facility, we're going to be reaching out to you. So we don't anticipate that you would be hearing on your end without us hearing. But if you do, please reach out to us and we can help sort out what the situation is and make appropriate recommendations. So at this point, I'm going to pass the mic to Polly Carver-Kim. Polly's our communications director for the Iowa Department of Public Health, and she's going to talk to you a little bit about communicating with the media and the public.
I am so sorry. Anyone who just had headphones on, I just threw the microphone on the floor. So, excuse me, that's not a good way to communicate. Thank you for joining us. I'll be very brief. And my main message to you is if you need assistance with communication resources or letters to parents or those kind of things, please don't hesitate to contact me. I will have my contact info in just a couple slides. So my first slide here regards working with the media. I don't know, you may get calls from the media as they try to localize some of their news stories and they want to know maybe how you are handling the situation. That may be a foreign territory for you and you might want to just avoid them at all costs. However, best policy is to go ahead and respond to the media and do so as quickly as you can. Answer any questions that they have. But always in the context of confidentiality. You want to provide as much information as you can, but of course, as Dr. Garvey said, you don't want to put anyone's confidentiality at risk there. If you have questions, if a reporter does call you, please don't hesitate to contact me, and I can talk you through it, or we can brainstorm on some ways to handle that media call. Talking about confidentiality, reiterating what Dr. Padati said, we are posting the numbers of people who are being monitored, tested, and those test results every Monday, Wednesday, and Friday, but being flexible if something urgent needed to be posted. We're not releasing anything beyond just the numbers, not any cities or counties or regions of the state for those individuals, because there's nothing that we can ask the public to do, a public health message with that monitoring and testing information. If we did have a case identified and we decided that it would be in the public health interest to release more information, we would do so, but we'd work in cooperation with our local public health officials to make sure everyone was on board with whatever information we were releasing. Going on to social media, a lot of you do have social media accounts. If you want to share information with your parents, I'd encourage you to follow us on Twitter and Facebook. We post a lot of good information about COVID-19, and you know then that that's good factual information that your parents can trust. Feel free to share whatever we post. We have infographics on our page that Dr. Garvey will share shortly. Feel free to download those and use those any way you want. And check that frequently, because we are trying to update that as much as we can. We encourage you not to engage what we call the trolls, the people who like to comment on whatever you post on social media. Instead, I would just either ignore any negative comments or correct them with information that is the correct information that you wish to share. And here's a picture of some of our social media infographics that we have for you, or not just social media. If you'd like to post those in your centers, that's fine. You can do whatever you wish with any of these and any of the ones that'll come up soon too. And then the next slide has my contact information for you. Again, email is probably at this time the best way to get a hold of me. Feel free to contact me with any questions you might have. If you have a question regarding a health situation, of course, you can contact your local public health department, or if you've got my email handy, I can try to see if I can contact the folks here and get an answer for you as well. So with that, I'll hand it back to Dr. Garvey. Thank you.
Great. So if you have questions, please type those into the Q&A box that's on your control panel. I see we have a few questions that have come in. In the meantime, while we're waiting for people to kind of type their questions in, I'm going to take the opportunity to show you where to find resources on our website and on the CDC website. So bear with me for a minute as I switch my screens. All right, so to get to the Iowa Department of Public Health website, our address is just www.idph.iowa.gov. Then you can click on that COVID-19 banner, and that'll take you to the information that we have posted for COVID-19. So the first thing you'll see is the cases, the numbers of people that are being monitored by public health authorities, and so these are people returning from mainland China. Again, for all other people in the level 2 and level 3 travel advisory areas, we're asking them to voluntarily monitor themselves, so we don't have numbers for those people. And then this chart also lists the numbers of people being tested for COVID infection in Iowa. As you scroll down, we have some general information, but then we start seeing our targeted resources for specific partners. Now, currently we have guidance for schools, the K-12 guidance, and a lot of that has been the basis for the recommendations that we've provided in this presentation, but we are also working with our partners at Childcare nurse consultants to kind of childcare-ize that, so make that more applicable for you all. So in the coming days, there will be a guidance document posted here that's specific to childcare centers and homes. So look for it. We'll have a new header that says childcare centers and homes, and the guidance document will be posted under there. But in the meantime, like I said, the K-12 guidance, I think, is a good base document that would be helpful for you all. So this is the K-12 document. In addition, there's a lot of fact sheets. So there's fact sheets for talking to children about COVID-19. Maybe that's something you want to share with your child care families. Or we have general fact sheets for the public. We have some information on travelers. And then we also have the infographics that Polly had mentioned in her presentation. So they're all posted on our website. So you're welcome to use those however you see fit. And we would just appreciate your assistance in trying to get this information out to your families and to Iowans in general. So at this point, I'm going to transition to the CDC website. So just www.cdc.gov. If you click on coronavirus, they have a plethora of guidance documents for all types of different venues and partners. So there's information for how it's spread, for symptoms, some frequently asked questions. We have information for communities, for schools, for all different types of partners. So feel free to pull any information from our site or from the CDC site, and so that'll help you in your communication with your family, so you're not having to kind of, reinvent the wheel. Okay, so at this point, we're going to transition to answering questions. So we'll pull those up. So the first question is, are quarantine policies being changed after what happened on the Diamond Princess, or will they continue to quarantine the entire ship if coronavirus is detected on board? I'll look to Dr. Padati for that.
Yeah, so it's a great question. When we talk about quarantine, so quarantine is the practice of asking people who could have been exposed to an illness to not move. And then when we talk about isolation, and I mean that with a public health term, not just a general term, isolation is when public health asks people who are sick with something to not move. And so we think about isolation and quarantine as public health recommendations. Various jurisdictions actually have the ability to enforce legal orders associated with quarantine and isolation. And the way that that happens and when and how and all of that, it depends on the jurisdiction. So what we saw in terms of the approach that was taken with the Diamond Princess, that was sort of up to the governing authority at the time for where that ship was located, right, in Japan. And so different approaches would be taken in different jurisdictions. And so, again, I would just say these are tools that public health has available, and we use them for a variety of illnesses, things like measles, foodborne illness, tuberculosis. So they're examples of tools that we use that we're flexible with. We always want to be using the least restrictive means possible, and just balancing somebody's individual needs with, the protection of the public. So I would just say the way that looks just depends on the illness, the circumstances, and the jurisdiction that's providing that guidance.
We've had quite a few requests for Polly's information, so I just put that slide back up on the screen for those that wanted it. We also had a question about the PowerPoint presentation. So after this webinar concludes, we're going to archive this webinar, which means that we'll upload it onto YouTube, and then you'll receive a link so that you can share this webinar with others who weren't able to join, or if there's pieces that you missed, you can go back and review those. In addition, you'll get a copy of today's slides. So everyone who's registered for this webinar will get that link, and we'll get the slides from today. So there's a question about ISU students who were studying abroad in Italy were sent home this week and are self-isolating. What does this mean, and how effective is it?
Yeah, so, again, the recommendation that we shared this morning, and what many people may decide to do, is that if somebody was in one of these countries that we know has community level spread, and again, we know that might change, But if somebody was there, we want them to consider staying home and staying away from others for a period of 14 days. And the idea here is that if we knew that an illness was circulating in a community and somebody could have potentially been exposed, we want to try and keep them away from others. And again, we're looking at the way that this virus moves, right? It moves from one person to the other. We think it moves, best when we're within 6 feet, and it moves quickest if somebody has a lot of symptoms. And so we think through, okay, what can we do about that? Well, we can ask people to stay away from others as much as possible. And if anybody becomes sick, we want them to particularly stay away from people and work with healthcare and public health to be evaluated if they need to be. So those kinds of measures, and I know it sounds very basic, but the measures of asking people to stay home when they're sick and stay away from others, if they think that they've been exposed to something, those are actually pretty effective measures, and they're good for a variety of illnesses, not just something new like COVID-19, but these are the techniques and approaches that you'd want to take if you'd been around, a flu outbreak or people with norovirus, things that you can do to help protect, people around you. There's a question about recommendations for home visitors who see young families and children in homes daily. I think if you're asking about home care providers, that's a great question. It's a topic that's come up, and it's something that we're working on, putting something together for. And again, I think we can think just generally about what we know about illnesses like flu and, like a new virus like COVID-19, and what we know about how we can protect ourselves. And I know it sounds simple, but again, hand washing and staying home, when we're ill are very important and effective measures to take for a variety of reasons. There's a question about how long does it take from testing to diagnosis? Approximately a 24-hour turnaround period, I would say, depending on, where the patient is being evaluated, where the samples might be coming from. So about a day. There's an individual, if you have somebody going to Seattle, do they have to be out of work 14 days no matter what? Again, I think it's great that people are thinking through what we can do for people and how we can, anticipate potential exposures. So certainly if, somebody was around somebody who was sick or around a known case, we'd want them to be communicating that. And again, thinking about what is the level of flexibility that your own, agency or institution has in having somebody cover or having somebody work from home or use sick time if they were to need it. I think thinking through all of those things would be important. But if you're asking right now if sort of travel to places of the United States are treated sort of the same way that some of these other countries with ongoing transmission are being treated, no, we're not there at this point. But again, I would just ask you to keep in mind things do change, and you're always welcome to reach out to local public health and visit our website as well.
So we have a comment that someone has a few questions about HR protocols on affecting staff in residential settings, particularly sending them home versus quarantining and when they can come back to work. I'm not sure the context of those questions. If you want to follow up with us, we're glad to talk to you in more detail of that.
There's a question about in a daycare center, to be cautious, is it best to clean more than you already do, wash hands more? Yeah, I think that's a reasonable thing to do. Again, we want to make sure that we're always cleaning and disinfecting using an EPA registered disinfectant that's appropriate for the surface that you're using, and you're following the directions on that label. But again, the things that we would recommend and are recommending around something like COVID-19 are the things we would want you to think about, in a flu situation, or if there were other illnesses circulating, in your environment. We're just getting at some sort of tried and true measures that can help protect you from a variety of illnesses. There's a question. I'm aware of one child care center that's changed their policy to a lower allowance of a child's fever. Is this an effective filter for a child care center's illness policy? That's a really interesting question. When we talk about fever, particularly in the context of COVID-19, we're talking about measured fever, but also subjective fever. And so, I think the way that an individual, center or, institution describes their fever policy, I think there's a couple of different ways places can do that. I think, being flexible is important, and remembering, fever is a good marker, but also thinking about symptoms and wanting to be flexible if somebody is saying that they're ill in general.
There's a question about, do we have concerns with spring break travelers over the next few weeks, and could we see a spike in spread when spring break concludes? And I think that we're all just want to make sure that people who are traveling and people who are here at home are taking those steps to prevent their chances of becoming infected. Again, the everyday steps. I think that certainly we're watching this, and we want to make sure that people are, again, taking those steps to cut down on their chances of becoming ill when they're traveling, just like they are when they're in Iowa.
No, I think that sounds very reasonable. I think there's a sort of related question about, is it not a matter of if, but more of when and how severe COVID-19 will be introduced? And again, I know that this has been a very quickly moving situation, and it's completely understandable for things that are uncertain or new or unclear to make us feel nervous or anxious, or even scared, but I think that what's important is I want people to understand that there's places you can go for information. There are things we can do to prepare for if this virus were to be introduced in our communities. And we do have a lot of things that are working in our favor, right? The more conversations we have about ways to be flexible about working from home or taking time off when you're sick, the more everybody knows about, what symptoms to look for and what's appropriate to be managed at home. Those are great things that are going to help us limit the spread of this virus and other viruses in our community. And so, I think that this person is rightly recognizing that as more jurisdictions and states report cases, it does become more likely that this may be something that we would need to manage. But we do have tools and abilities and options to address these things. And this is the time to have those conversations. There's a question about the impact of the virus on kids versus adults. I think that, again, this is an example of a place where we probably have a lot that we're going to continue to learn about this virus. I can tell you that some of the early reports would suggest that children are maybe not as affected as older adults, particularly those with chronic health conditions. But again, I would say this is an example of a place where we have a little bit more to learn. And the more we can do to protect everyone in our community, the less likely it is that any virus can move among us.
So excuse me, I'm just wanting to show you where our Healthy Childcare Iowa map is on our website, so that you all know how to access those resources as well, because they're great subject matter experts for childcare facilities. So I should be sharing my screen. You would just go to our page, our Iowa Department of Public Health page, which is again idph.iowa.gov, and then go to the, I think you can get to it this way, the A to Z index. And you'll see the Healthy Childcare Iowa website, and you can click on this link and it will take you to the map of your designated childcare consultants. So again, make sure that you're accessing these great resources within your community. And we're happy to have Heidi here with us today. So thank you, Heidi. Okay, we'll finish up these last few questions. It has been stated the virus does not survive long on surfaces. How long is not long?
Yeah, this is again an example of a place where we probably have a little bit more to learn about this specific virus. There are some viruses that when we say that they're hardy, they can live on surfaces for days to weeks. It doesn't appear that this is the way that coronaviruses typically behave. So, less than that. But again, I think this is an example of a time where, we have more to learn.
We did.
There's a question about why is there so much hype around corona versus flu? Is it more deadly? And thinking through those comparisons. I think there are some things that coronavirus and flu, COVID-19 and flu have in common, and some things where they differ. I think that it's important to recognize we don't have evidence that COVID-19 is circulating here in Iowa. We do know that flu is, and unfortunately, flu causes illnesses and deaths every year. So it's important to think about preventing flu, and that includes things like getting your flu shot, and keeping yourself healthy and protected from other illnesses like flu is important. And that's a good thing to do, no matter what illness we're talking about. But I also think it's important to keep in mind that when we talk about doing things like washing our hands and staying home when we're sick, those are, also going to protect us against a new virus like COVID-19. And then I think there are some questions trying to compare mortality rates or infectivity. And again, I think this is an example of an area where we still have a bit more to learn, about COVID-19. But I think there are good measures that we can take to protect ourselves from COVID-19, flu, or a variety of illnesses.
Anything you want to say about children versus so we had a clarifying question asking whether the restriction for travelers coming to Iowa from China, whether that would include people who reside in China but are visiting the U.S. And it would include all travelers from China. There are some restrictions on who can travel to the U.S. from China right now, but anyone who is traveling, who's allowed to travel, would be monitored through the current process.
There's a question about if a parent has traveled to an area with community transmission and is self-isolating, should the child in the home also stay home? Other people in the home don't have to have any sort of isolation or restrictions, as long as somebody has no symptoms and is isolating for themselves. So that doesn't apply to others in the home. There's a question about whether there's a need to wear a mask on a plane. There's no need for anybody in the general public to be using a mask on the plane or in general life. Again, the measures of sort of staying away from sick people, staying home when you're sick, and washing your hands are really the measures you want to be taking in general to keep yourself healthy.
Got a couple questions about vaccine. We know that there's a lot of work going on around vaccine development, but we know that it'll be a year or more probably before any type of vaccine would be actually available for use for the general public. So another question that talks about treatment, and do you want to touch on it?
Yeah, again, we don't have any currently available treatments. There are some that are sort of being evaluated, but it's likely going to be at least several months before something like that would be widely available. There's a question about what specific symptoms to sort of ask people to stay home for, and the duration of time. I think a 24-hour fever-free policy is reasonable. And when we think about other symptoms, and I know that this gets hard because, for example, there's a lot of things that can cause a cough, right? Sometimes allergies cause coughs. I think, what we want to emphasize is that people are aware of, what symptoms to look for, and that we can be flexible about, allowing people to stay home if they need to. And again, I know that there's some challenges in that, and certainly thinking through whether you had, multiple people with symptoms or somebody who's describing that they have new symptoms or worse symptoms, paying attention to those sorts of things are going to be valuable.
So we have a question about whether a wellness center in a community can do testing if someone needs to be tested for COVID-19. And any healthcare facility in Iowa can contact us, and we can coordinate testing with the state hygienic lab. And so that is a service that's available across the state. We're asking all health facilities to do the screening. So again, this is a service statewide. that would be in place if there were someone who met the testing criteria that presented for care. There's a question of, will public health be contacting religious organizations, or do they need to contact Iowa Department of Public Health? And we're in the process of actually developing some guidance materials for our worship, related to worship services. And so those will be posted on the IDPH website on the COVID-19 page in the coming day or two. Yeah, there's some more detailed questions about isolating sick individuals in the home. And CDC actually has some really detailed guidance about how to provide home care for individuals. I'll walk you through how to get to that if you want to look at that in more detail. So we're going back to the CDC webpage, clicking on the coronavirus tab, and I apologize if it takes me a few extra links to get to this. I think it's in this link. I'm going to go back one screen. I apologize. They have a really good guidance document. There's just a lot of resources that are being added to this site, and so they're reorganizing them a bit. So it's going to take me a second to find. Here it is. Learn how to care for somebody with COVID-19 at home. So interim guidance for preventing the spread of coronavirus in homes and in residential communities. So this is, I think, good guidance for everyone to kind of get familiar with. And this is, a lot of this information is posted in a lot of our materials, but this is, I think, a good document to take a look at if you have questions for what's involved with providing home care for someone with COVID-19. We had a question about whether we could transpose these Q&A into a written format. Excuse me. For the sake of time, we're really just archiving these webinars. And so again, everyone will receive the link to review the webinar if you want to share that with other people or want to review some of the discussions we've had here today. So questions about symptoms, and really fever and respiratory symptoms are associated with COVID-19. I think this question is asking about, can people be, there's a question about COVID-19 and biphasic. If you want to follow up with us, I'm not sure I'm following that question. Just give us a, reach out to us and we can help provide some clarification. We also have a question related to working at a summer camp. If staff become sick while they're at the camp, is the recommendation to send them home or to keep them at camp? And I think that depends on a couple of things. It depends on whether you have the facilities to isolate an individual, so they would need to be able to be fully separated from others. They would need to have access to a bathroom that's their own, that type of thing. And it would depend on how sick they are. So I think any situation like that, please work with your local public health officials and they'll connect with us if we need to engage as well, and help you kind of sort out what's the best option for that staff member. There's a good question here about, is there documentation that's needed to return to work? And we're really trying to emphasize and recommend that businesses do not require a release from healthcare professionals for staff members who have previously been ill to return to work. And the reason we're doing that is because we know that we're going to have a whole spectrum of illness, from more mildly ill people to more severely ill people. And we want to allow our healthcare communities and facilities to really focus on those more severely ill Iowans, and we don't want to bog down the system with releases for work. And so we're really recommending that businesses do not require releases to work to allow those individuals to come back. So at this point, I think we have covered all of our questions in the question box. I'm just scanning the chat box to see if there's any other questions. Just requests for slides and links to the archived presentation, which everyone will be receiving. So we'll close the webinar for this afternoon. Again, we really thank you for taking the time to participate in this webinar. Certainly, if there's other resources that you need, please don't hesitate to reach out. We want to support you as best we can. We appreciate our partners with Heidi and Healthy Childcare Iowa. So they're great resources as well, and I would encourage you to reach out to them if you have other questions related to childcare provision. So have a great afternoon, and thanks again for joining.